For everyone with an interest in MASH, or more broadly, steatotic liver disease, Surf's Up. Season 5, Episode 2 of Surfing the MASH Tsunami, our discussion with patient advocates about what everybody is looking forward to in 2024, starts now.
Today, on Surfing the MASH Tsunami.
If you read the resmetirom studies, we're actually not talking about a huge group. When we talk about fatty liver disease, we're talking between 1 in 3 and 1 in 4 globally with it. But when we talk about the population that would be in the system now, we're looking at a much smaller number. And so, we're looking maybe between 300,000 and 400,000 or so in the United States.
People will have a sense that, we have a drug approved, I should be able to get it. And most of the population actually will have a lot of trouble getting it.
Europe is also very, very diverse and can be also a little bit tricky days, but in the moment different kind of initiatives to the EU Council. Maybe we can push to harmonize somehow some of the legislation for faster access of the drug.
It comes down for me to know what the payers are going to do, and I think Jeff alluded to this along with Tony and Wayne. This is also going to be an issue in Europe. Medical insurance companies have a large role to play in this.
Pharmaceuticals are unique in that it's really a tripartite market. One person prescribes, one person pays, one person takes. Now, sometimes the person who pays and the person who takes is the same person. If those three things don't work in unison, then you've got a problem. The easiest way for a drug not to succeed, for example, is for the first several patients who take it to fail to comply with it, because then the doctor will not see success.
Every week, a global community of steatotic liver disease stakeholders comes together to explore the most critical challenges in diagnosing, treating, and developing medications for patients with MASLD and MASH. Join liver health advocate Louise Campbell, pricing and forecasting guru Roger Green, and this week's guests, patient advocates Jeff McIntyre, Tony Villiotti, Wayne Eskridge, and first-timer Milan Mishkevikj, as they discuss the implications of 2024's key events on patient care, this week on Surfing the MASH Tsunami.
So we realize that we've got really good time coverage here. It's 3 p.m. in New York, where I am and where Jeff is and where Tony Villiotti is. It's, I guess, 1 o'clock where Wayne is. It's 9 p.m. where Milan Mishkevikj is. And it's 4 a.m. where Louise is. And in fact, as Louise points out, it's tomorrow. So we've designated her our visionary for today, so she can see a day ahead of the rest of us. But we're all here. Different people, different perspectives. I'm really excited to see how this is going to go. Why don't we start by everybody just saying hi? I'm going to go around the table. I'll go to Tony. How are you this afternoon? Tony Villiotti, how you doing?
Hi, Roger. I'm doing fine. Thank you.
You sound well. The first couple of times Tony was on this podcast, we had some sound problems, but you sound really good today. I think all this will work out really well. Next to him, we have Jeff McIntyre, who is clear vocally, but picture's a little fuzzy, but we don't take pictures, so it doesn't matter. How are you doing today, Jeff?
Boy, if that isn't the story of my life. I've got a voice made for radio, Roger. Thank you for having me.
I have a face made for radio, so I understand exactly what you're talking about. Wayne Eskridge, good to see you, Wayne. How are you doing?
Oh, I'm doing well. I'm getting back to life as normal after going through chemotherapy.
Yeah, it's no fun.
No, but it's good to be here. I appreciate the invitation.
And I'm delighted to have you with us. Louise, I think that's even less fun than 4 o'clock in the morning. How are you doing this morning?
Absolutely. And nice to see you, everybody, and Wayne. But I'm doing really well.
I will speak for Louise and say that we're delighted that one of our sometime colleagues isn't with us, because if you were an Arsenal fan, you would be completely insufferable today. Liverpool fans and Tottenham fans feel perfectly happy. We don't have any Arsenal fans on this call, do we? Okay. Then last, let me go to Milan Mishkevikj from the European Liver Patient Association, who's never been with us before. Milan, how are you today?
First of all, Roger, I'd like to thank you for the invitation. It's my pleasure to be among so many famous advocates, I will say, for liver disease. And my honor is that even it is dark in my country now, 9 p.m. in the evening, but I have still strength to be here.
I have a particular fondness for Milan, because the first country where Surfing the MASH Tsunami was ever the number one medical podcast was North Macedonia, which is where he lives. So I give Milan personal credit for our success in that part of Europe. Thank you for that. Milan, okay, do us a favor. Since you've not been with us before, just take a couple of minutes and tell us a little bit about your background and how you came to be where you you are right now, doing what you are right now. And then when you're done with that, I'll have another question for you, and then we'll get going.
Thank you, Roger. I'm in the moment a board director in the European Liver Patient Association. My background is working in the liver field more than 10 years. I have a personal family story, like a caregiver in this field, connected with my mother. I started an organization in North Macedonia before 11 years. My first contact with liver disease starting with hepatitis. And after that, I realized that many challenges among the liver disease exist, especially in my country and also in the European level. And somehow I proceed to work in that field to achieve some kind of goals, to make awareness about liver disease, to see who are the new possibilities and how to change the landscapes about liver disease, especially in my country. After that, Hypercenter becoming a member of European Liver Patient Association and in another also international organizations. I saw great possibilities through these networks, how to proceed and update my knowledge, first of all, and second, how to proceed and to achieve our goals on national level, but in the same time to work and fight with European and global challenges with liver diseases. And how I mentioned in the beginning, this field was for me a little bit outside of my range. I was a caregiver, and I realized how I was involving more and more deeply in all the processes, from the prevention, awareness, diagnostics, policy, all the necessary details in, let's say, like a package in one circle of liver disease. I realized that we are missing a lot everywhere, not just on the national level, but through different structures and networks and partners, how we can change this landscape was really crucial for me to proceed to fight and to find allies somehow to support our work, to support the work of all the other associations who are somehow involved in all these processes. And we realized that the liver diseases are not so, let's say, rare among the population in Europe and especially in the Western world, that we need to do a little bit more to change the, let's say, perspective for the next couple of years, because how we know on, how we say in ELPA, with the boots on the ground and a lot of new research which is coming on the table, somehow the hope for our communities is very big. And this is a huge advance for us, like advocates and patient in the patient community, to work with different stakeholders. That means that the scientific community and patient perspective, I will say, can change a lot. After that, it's coming the policy decision makers who need to accept all the challenges which we are bringing on the tables together. Corporate industry is also one of the most important partners who, let's say, provide us with very strong, say, new research, developing new research medicaments and all of necessary things which we can fight for better quality of our communities.
Milan, that's a fantastic introduction. Thank you. The last time you and I spoke by phone, I think you were in Brussels. I know you spent a bunch of time there at the European Parliament. And the last time I saw you, I guess, was in Vienna last June. But it's good to have you with us today. Now, we ask everybody the first time they come on the podcast to tell us one secret about themselves that you wouldn't guess if they didn't tell you. So what's your secret for us about you?
My secret today, I will say that I was, how mentioned in previous question, I was a caregiver, but now I'm the patient. That was the secret. I suddenly discovered that I have a problem with fatty liver. I will say, I don't know, MASLD, or whatever is going to be the completely name on the end. I was surprised because really I'm not using alcohol or this kind of thing, but my lifestyle, especially with food and my physical activities, were somehow a minimum. One of the biggest reasons, and I still have this problem. And I must tell you, this secret on the beginning was weird for me because I didn't expect that from caregiver I will become a patient. And this was discovered, I must be honest, in Barcelona on ESO. On ESO, I make a checkup and they say to me, you have a fatty liver. Some of the professor who was present there. And after that, continue my examination in my country. After that, in every opportunity when I have something with screening of different campaigns or something like that, I'm doing checkups also for myself to see what is my condition in the moment. But really, my style of life was a little bit bad, I will say, and somehow that bring me a little bit trouble in the moment. I need to make a bigger changes in the future, especially in my life, and also with the expectation of the new coming drugs. Maybe it's going to be much easier because I'm so happy that the news which are coming, especially the last month, it's with high expectation for us like a patient communities, and we hope so that very soon we will have something very interesting on the table.
Well noted. And I would say that makes half of this session patients or folks who've had history of liver disease. And in fact, most of the advocates do, not just as caregiver, but as patients. So good luck with that. As you mentioned, good news in the future. One of the things that just hit me today, pardon me, because it's kind of tangential, is, they talk about March 14th as being Pi Day, right? Because the number pi starts 3.1415. So I'm wondering what kind of Pi Day one has. I mean, PDUFA begins with a P also. So there may be some interesting linguistic synergies in our future, but well noted.
Thank you very much, Roger, for the invitation again. And I will tell you one more secret. Before 1 year exactly, in this month, I was visiting one of our members in ELPA. I was in Egypt together with my colleagues, and we're discussing a lot about the challenges in Egypt and everything. And I make also my screening of my liver. When I saw the last numbers, all my colleagues jumped on me because they performed the screening in front of everybody. I was like an example there. They were thinking that I'm the youngest, I will not have the problem, but a little bit was opposite situation. But I'm trying to change this 1 year, and I'm fighting very strongly. I must be honest, because really my life is somehow mixed with different activities, and I'm a lot of time also in front of the computer, and all of these things need to be changed in the future.
You've got a couple of role models on this call and elsewhere throughout the community. So you couldn't be hanging out with a better group of people if this is what you need to do for your life. Okay. So with that, let me go to everybody else. Simple groundbreaker. One good thing that's happened in your life in the last week, personal or professional. Brave one, go first.
I'll start. In the past week, for the last 4 years, we've been running an English language support group on Zoom. But in the past week, we laid the groundwork to begin a Spanish language support group, which we'll be rolling out in April of this year. So something we've been looking forward to doing, and it finally came to fruition.
That's tremendous. I know this is something you've been working on for a long time, so that's very, very exciting. Congratulations. Next.
Oh, I can step in. Most of the community knows that I was a poster boy for cirrhosis because I was able to significantly reduce my liver stiffness. Now I am also dealing with multiple myeloma, but this just went into maintenance for the disease, and I'm officially in remission at this point. So I was really pleased by that.
Excellent news, Tony. Not Tony, Wayne. That's fantastic. So congratulations on that, because that takes a lot of hard work and going through some really tough treatment.
I've been there, not multiple myeloma, but I was there a dozen years ago. I'm feeling it with you. That's not the most fun I've ever had in my life, but you look good, and it's good to hear you're in maintenance, and you got a lot to do and a lot of time to do it. So that's great. Louise, were you going to jump?
I was going to jump in next. I suppose my good thing was that I played golf yesterday or today in your part of the world. I'm not too bad. So I'm very happy with that. And what was interesting here in the last few days was they've announced a processed meat ban, particularly ham, in schools and on their menus. So they're changing school menus. They don't have crisps. They don't have full sodas. Obviously, the manufacturers of ham products are not particularly happy, but they are making changes in what you can sell in school canteens in Australia. And that is a big win, not only here, but as an example. And I know different countries do different examples of how we're managing to look at different changes. But that one I thought in Australia was a nice one to share.
That's great. That is fantastic. Couldn't agree more. Jeff or Milan, go ahead.
Well, I'm in South Carolina once again, coming to you guys, and up in the Appalachians. And on the spur of a moment, last weekend, I went out and did a road race, and it really caught me off guard about how super great and charming of an experience it was. And so it was very small. It was a charity run, and it was for a local center that helps folks with intellectual disabilities, help them in the community and whatnot. And I would say probably 25% of the field, 25% of the 60 of us that showed up were people with disabilities. Another probably 15% were people with dogs. And even though I don't really live in that community, if you will, it was just so really nice to suddenly come out and be a part of the community, to be able to contribute positively, to be able to support each other. You know, I got to run in, but at the end of the day, it was really about giving people high fives and feeling good and being able to contribute and learn a lot more about kind of what these individuals are living with on a daily basis. It was just good vibes all around, good weather, and I just feel really fortunate to have been able to be witness and participant in that day. It really speaks to the power of community.
That's fantastic, Jeff, and heartwarming to hear about. It's a really good thing. Milan, good news in the past week?
I was working a lot, I must be honest, trying to finish our campaigns about World Cancer Cancer Day and preparing for Rare Disease Day, something like that. I was trying to connect all the details about between all the risk factors, especially when we are doing the campaigns. Every time I'm trying to mention also the lifestyle changes and the problem with the fatty liver and everything that is connected with the diseases. Some positive example, I was in Paris. I don't have something particular because more or less my time was connected with meetings. If you ask my wife, she will kill me one day.
Yeah, several of us have that problem. I understand how that works. So I'm going to pick something really prosaic, which is it snowed today in Philadelphia. And you wouldn't think that would be the good news. But this is the first time we've seen snow here in over 2 years. And it used to be a regular occurrence. I'm a skier. I like 4 seasons of the year. And I find it troubling that climate has changed so quickly that stuff never happens. So it was snowing this morning. I immediately got in my car and got out on the road. I've got a 4-wheel drive car, so I was able to drive a little bit in slush and mud and yuck, and I just felt inspired. It was wonderful. So it's trivial, but not unimportant in the scheme of life. Okay. Let's dive in. So I mentioned Pi Day, which is actually something that just hit me as I was listening to Milan. But I think part of the reality we're all living in right now is that if you talk to anybody who's involved with the community and you ask them what's on your horizon, they all start by saying, well, there's March 14th, which, as we all know, is the PDUFA date for resmetirom at the FDA. And with the release of the New England Journal article in the past week, I think there's been increasing excitement and energy everywhere, everyone I talk to. But it's interesting. It feels like one thing in the U.S., which is where the drug's going to get approved. And it's felt a little bit different in other places where the drug's not getting approved yet. So our first question, what I'd like to ask each of you to do, talk a little bit about the mood within your organization and your patient communities. And then Jeff, because I know that you've got portfolio both in the States and beyond, I'd love to get your feedback going last on what you see is different between what you're hearing from folks in the States and folks in other places. Take one of the Americans first. Tony, Wayne, jump on it.
Yeah, I'd say the mood in our organization is kind of quiet optimism. We're kind of holding our breath a bit because, as long as there's uncertainty about what the FDA is going to do, it creates uncertainty in the minds of patients. But I think just this is a really landmark situation here where if the FDA finally recognizes that this is something patients want and need, that is going to be a major happening. So we're holding our breath a bit, waiting for it.
Okay. So any preparation for after you're done holding your breath, or right now you're still kind of in the breath holding phase?
The impact of drug approval won't really affect our day-to-day operations very much.
Okay.
We're doing no preparation for it.
All right. Wayne?
I guess we're cautiously optimistic. We're concerned, I guess, about over-optimistic assumptions on the part of the patient community. People will have a sense that, we have a drug approved, I should be able to get it. And most of the population actually will have a lot of trouble getting it. There'll be quite a bit of patient stress because of insurance coverage, and there'll be articles that they read, and there'll be a lack of understanding of what the limitations are and what the concerns are for which patient groups are able to get it. So helping people understand the environment that we'll have the rest of this year is something that we're trying to think about how to focus on that, or how to help people understand what the reality is, because the fact that FDA issues that license does not mean that people suddenly can get help just by going to their doctor and say, I'd like to do this. So the patient stress that will come, there'll be optimism on the part of the patients, hopefulness, but also significant discouragement by a lot of them. So we worry about that.
Milan or Louise, just about what you're seeing where you live. And Louise, I guess you live in 2 places. And Milan, you've got a whole continent to deal with, but either of you go ahead.
I think it's going to be interesting. I agree with Wayne. There certainly is, from what I feel and what I see with people, a skepticism about how many people will be given access. And I think the devil's going to be in the detail. What do you have to have achieved to be eligible for treatment with resmetirom or any of the medications coming up? Have we a structure in any healthcare to be able to jump those hurdles? Or are we going to be inventing those hurdles to jump before you get access to the medication? And I think the US is going to be obviously the tester for that. It's got a big enough population of people people affected to just primarily focus in the US. So it's going to be up to the rest of the world to develop their own strategies. Now, I think if I look at the UK, we're certainly well placed to be able to use non-invasive technologies to locate those at higher risk to get them to the right people. Who's going to prescribe? Is this going to be endocrinology, who currently don't look for fatty liver disease and fibrosis? Is it going to be cardiology, who don't look for liver disease and fibrosis? Or are we purely going to pigeonhole this in the right way of being just liver disease? So I think that wouldn't necessarily be the right place, but it's currently where most of the patients discovered are located. So we have an interesting road ahead. If we look at Australia, we are still going to be approving ultrasound as the first non-invasive technology to locate fatty liver, which means a lot more processes to look at the fibrosis side because we don't have enough access. And obviously we're hoping to get Leon Adams and a couple of other physicians when they formally announce that. So I think we don't have universal ability to locate these conditions. That's the concern for me.
I agree with Wayne, with Louise. They give a bunch of examples where we can be somehow concerned about all the situation when it's going to come to access. Europe is a little bit different by the access because the social systems in different countries depends of the also it's very important to see high income country, low income country, middle income country acceptance also. It's interesting. I know after FDA, EMA will try immediately to see all the possibilities for approval of the drug on the market. I think the bigger countries will have much easier success to get the access. This is the first, let's say, step. But I think USA, like one of the most important markets with all the characteristics, how Louise mentioned, will have enough, let's say, to see about the success of the drugs and everything, how it's going to go there, how to be changed in Europe. And we are very excited that in many countries we have, Europe is also very, very diverse and can be also a little bit tricky this, but in the moment through different kind of initiatives through the EU Council, maybe we can push to harmonize somehow some of the legislation for faster access of the drug and to see how we will be the proceed. Also concerning me, also the same issues Louise mentioned, who is going to prescribe, how is going to go the process, what is going to be, because we have different countries with different strategies in Europe, but it's the best option, first of all, to have this access approved and in ongoing process how to finish, let's say, the other challenges who's going to come on the way. We are happy, in the moment, and we are also concerned how Louise mentioned. I hope so that everything is going to be in good relations with all stakeholders and how we will proceed, how to find a way, how the patient have much easier access to the drug.
So, Jeff, that gives you about 5 places to jump off, to start from.
Well, I don't want to be redundant. Certainly, everybody makes really solid points on this. I would say that we are cautiously optimistic about the March 14th PDUFA. I think resmetirom has everything in the right place, if you will, but there's always a little bit of an X factor when it comes to the FDA. And we know that it's, from history has taught us that it's not always approval or denial, but there could be some gray areas of sending it back for further information, et cetera, et cetera. And so when we see it, we'll believe it. That said, I think we very quickly move into the area of patient access. And so for us, if you read the resmetirom studies, which I'm sure you guys all have as well, we're actually not talking about a huge group. Now, when we talk about fatty liver disease, we're talking between 1 in 3 and 1 in 4 globally with it. But when we talk about the population that would be in the system now, this is not projected or, people that haven't been screened, we're looking at a much smaller number. And so, we're looking maybe between 300,000 and 400,000 or so in the United States for that. And so we want to make sure that the patients that are in the system that have the greatest need are able to get the access to that. And that's going to be through some education efforts. It's going to be through making sure that, the next step that's going to be so important in this is going to be the coding for this. And then as we work our way through the system, frankly, I don't know what the number is exactly, but the largest population that uses drugs that are approved by CMS for reimbursement. In the US, if you're not reimbursed, with a couple of exceptions for exceptional cases, like anti-obesity medications and insulin, I think. If you're not covered, it's almost not worth going to market with it on. And so pending the approval, and we have, like we said, the weather's, the wind's blowing in the right way from that. If you define the wind as the research and a favorable ICER hearing that they had off of this, we're cautiously optimistic on that as well. Our concerns when we begin to look at this, patient access, making sure it's the right patients to do this, that we get the coding, that we serve the patients that are already in the system. We do the here and now that's in front of us on this. And then we are able to engage with the payers. This is kind of the GLI strategy going forward with this, that as patients, we're engaging with the payers to make sure that they are aware that this happens, because we've got to have the reimbursement for this. If we don't, then not just the implications in the US, but that's when we begin to see those bridges globally begin to crumble, if you will, because if it's not covered by CMS, the likelihood of it being covered by NHS or being approved and covered by the EMA, those all become much more shakier foundations, if you will. And then once we've kind of established that pattern, then we can start talking with the private insurers to make sure that they catch up and that they're able to cover this as well. And we've laid a step-by-step foundation for building patient access by being able to do this. Internationally, again, I think EMA is going to be quick to follow on this, quick, defined in bureaucratic terms, of course. We think that that's going to be something that will happen with that. And hopefully other hot spots, we would look to Latin America, certainly Mexico, and then Central and Latin America for hopefully a quick approval process pending we are able to go through these other steps on this. And then this is the point. This is the time where we finally get to answer or to engage a lot of the questions that I think people have kind of kept on the shelf for a little while of what's going to be the impact. Is there going to be a rush of people with all different stages of fatty liver disease clamoring for a drug that really only specifically targets a narrow focus? How can we adapt our education and empower primary care and hepatology to be able to best deal with that question? And I think there's a question, even we need not engage it today, but down the road, there's going to be a question when a medication is approved, how's that going to impact clinical trials? We know we've got a lot of assets in phase 2 and phase 3 on this. Will people start dropping out of, placebo-driven clinical trials if there's a medication available? That's going to be another question that we get to engage off of this. And so we're optimistic, but boy, there is a lot of work still in front of us.
Yeah, most of which is kind of hazy. Yeah. I mean, you can see the basic contours, but until you get to approval, the specifics, I think, get a little shaky.
Yeah, agreed. I mean, I think it's the approval, but if we're only focused on this one component, we have to be planning for the second half while we're playing the first half on this. And there's some important questions still that are going to remain when the 14th comes around labeling, around plans for coding, all these sort of things that I think are going to be really, really important as we continue to move forward.
And then you get the price volume trade-offs and all kinds of other issues. A lot of the folks that I speak with who are either professionals or tied up with payer community are terribly intrigued about how you trade off price for volume. Well, those aren't the words that people use necessarily, in the States at least. But, outside the States, it's a very, very clear deal. You get a budget line, and if your price is X, then that's going to dictate how many patients you get because the budget line just isn't going to move. Here, it's not that fixed. But I think we all learned from Hep C that you can make the system work that way if you want. In the States, they certainly made the system work that way. Every time the price halved, the patient load doubled. So it'll be interesting, Jeff, to see how all that plays out. Where do you, to Jeff, I guess, and Tony and Wayne also, in the States, where do you see those issues getting mediated? I mean, are they going to be through the patient advocacy organizations? Are the professional communities going to play a role in that? Or, and what kind of support is there going to be around access, and where's it going to come from, do you think?
Well, you ask easy questions, don't you, Roger? Tony and Wayne may have a different impression on this, but my understanding is that there has been some conversations with the professional organizations. However, as patient groups, we have been largely blocked out of those conversations. There was an interagency meeting on the 24th of last month, I believe it was, that we asked repeatedly for patients to be involved in so we can be informed and help drive the conversation around patient access. And universally, we were told not to be a part of that meeting. And so I can't speak for the professional societies anywhere beyond that in terms of what their involvement is. We've gotten reassurances that there are things that are happening. That said, as a patient organization, we're not waiting for them. And so we're going to drive those conversations with the payers. We're going to make sure they hear from us. We're going to make sure that we are in communication with all the important stakeholders here on this and take it under our wing to make these things happen.
Tony, Wayne, are there issues that your organizations are working with around support supporting patients and getting access to medication? Well, A, access just to prescribers, and then B, access to reimbursement.
Just echo what Jeff said. We have not been asked or been invited to participate in any of those kinds of discussions. So our approach has been to kind of take a wait and see approach. Obviously, it's an issue that needs to be addressed. And I'm not sure that our little organization is best positioned to drive any of those conversations, but we're anxious to be involved.
We kind of sit in between Tony and Jeff. We have some involvement with those particular issues. GLI is very much at the system interface. They function, at the policy and rules area far more than we do. We have some contact with that. We have some advisory roles with some of the pharmaceuticals. We're participants in some working groups. But in terms of real access to the policy and decision makers, we don't really have much opportunity to do that. It's very difficult, as Jeff says, to have an influence from a patient perspective at this point in the game, which is sad, but it is a fact, and it really is.
Yeah, I understand that, and everybody's nodding. So to Milan, I guess, or to Louise, when you look at the U.S. around access questions, what are you hoping to learn that will help you in your countries? And I guess ELPA, because you work a lot with Brussels, you certainly have some significant government involvement on an ongoing basis. What will you be looking to learn?
In the moment, we are learning between us a lot, I think, because we already make different approaches to the policy decision makers in Brussels about this issue. And together with all our stakeholders on our, let's say, events, which was made in Brussels, was part of GLI and some other main stakeholders from Europe. And we try to already to touch the subject that what is coming in the future and what kind of changes need to be done, particularly in this area. And I think the good collaboration between us and Global Liver Institute, especially these 2 years, we already somehow announced the coming of the new drugs about this, and we connected like one of the most important risk factors for reducing the liver cancer. One of the things. The second part was that connection with the obesity, where we trying to divide it on the both different sides, like awareness prevention obesity and awareness prevention for liver cancer. In the moment that was going through the lifestyle and different physical activities, but also that how the new research coming on the table, it's coming a new hope for the patient where much faster and much easier can resolve the situation of this group of patients. We have some kind of acceptance, let's say, and the experience from USA, which every time I'm so grateful to GLI that every time they're contributing on our events, sharing all the necessary details about what is the situation in USA, how they struggling with all of these challenges, what are on the table, giving to the European policy decision makers to see that in Europe how need to proceed or how to do these changes and to be more acceptable for them. And this is the structure which we're trying to make for the next period. For that, the past 2 years we have so many events and everything was somehow connected with MASLD to be understood among the politicians, especially who are the groups, why is this silent epidemic ongoing in the moment, who are the factors and what will be needed to be done in the next period, how to reduce this. And already through the EU Council Britain Plan has different roadmaps which are giving some kind of perspective for us where we can push it like a target, because we excellent managed to find a way how to push, let's say, hepatitis in these roadmaps, like a prevention through the medicaments, vaccination, all of these things. And now it's coming the MASH and MASLD, which I think we have a strong added together with our partners, with you guys in USA, more comprehensive way to unite our voices and to share our experience, especially in how we are reaching our, let's say, main stakeholders to do a different kind of accessing of what next steps need to be done in this field. I think Europe, it's more and less policy decision makers are prepared. Also, it's coming the new election for June this year. We already, like European Liver Patient Association, working on, let's say, our advocacy work with the new members of the parliament and the new structure which are coming. And we're working especially very closely with some of the bodies. How ELPA is involved in different committees and groups and agencies like EMA, like HERA, and all of these important stakeholders for us, which they need to provide us with, let's say, somehow acceptance of our challenge, which is coming in the moment. moment. And that from that perspective, with the help from USA, which is very important to be heard what is going on, and because it's going to be the first country. I think with Jeff, with Wayne, with you, Roger, with all of you together, you will constantly inform, and this is going to be one more excellent approach for us how to proceed this very relevant campaign, which is still ongoing in the moment in Europe. A lot of different stakeholders, which we are working in the health, which we have some kind of, I will say, alliance for EU for Health alliance, which is providing us different opportunities to react in the moment. We have one issue in the moment, which I will tell you. In the last summit, which was before 1 or 2 weeks in Brussels, happened something unexpected for us in the health community. 1 billion euros was cut from this program. We're trying to change this perspective in the next period. We hope so that it's going to be accepted, our remarks and everything what we are doing with our main stakeholders in Europe to change that. But in every case, we have a good situation in the moment because the ENVI Committee for Health and Food Safety, non-communicable disease also, a report which was out, was already somehow speaking about this issue. And we managed to make some structures around that are prepared, and they will make more efforts who will change this. But we are not alone, I must be honest. We have so many partners in this fight, and giving slowly, but giving some kind of results. It's going to be difficult, definitely. I agree with Jeff. Even our structure is a lot different from USA, but possibilities are here. But I will not be so, let's say, optimistic, because we know what happened with hepatitis, and I still will keep that optimism somehow in the middle to prepare better field in the next period. But thank you, Roger, and thank all of you today and the next, let's say, interviews and everything what is going to be connected with this issue will bring somehow more strength to all of us and different experience moments which we can share in every moment. This is for me, let's say, somehow beneficiary, not just for me, but for all our members in Europe.
That's great, Milan, and thank you for that. Louise, you have questions you want to ask folks before we go on to next, whatever the next?
Well, I think it comes down for me to know what the payers are going to do. And I think Jeff alluded to this along with Tony and Wayne. This is also going to be an issue in Europe. Medical insurance companies have a large role to play in this, and I haven't really currently seen them recognize MASLD, MASH, NASH around the world as something they've really been interested in. But they are suddenly going to find that a large number of their members may well need this medication. But also the positive of that, of potentially making insurance companies drive education, early screening. How do you see that sort of thing working? Because I think we will learn a lot from that in Europe. NICE are going to have to approve this medication depending on cost. So not only have we the EMA, we've got the individual countries' approval, but I think insurers have a massive role to play in this. And I just wondered how you guys saw that playing out.
I will add something on the Louise comment. We have a diversity, big diversity. I agree with you. And we have 2 levels of approvals, the national levels and EMA. But also in the same time, we have through this, let's say, initiative through European Commission and the Parliament, which are trying to let's say, this recommendation, which are coming on. This is also a strong weapon for us, because if they accept it, and this is much easier after that to be disseminated to the member states. Because if you have on the main level, even it is a recommendation, it is not mandatory for them, but it's much easier that somebody accept that and somebody know about that. And after that, very, very easy, you can smoothly, with the national members, remind them that this exists, that this is a problem, and we have a lot of patients in particular countries, and that we need to be sell down. And somehow to get this access much easier than these roadmaps really, really are helpful in many different fields which they provide us. And I think if it's also for MASH, we will have much easier success, I think. For that, we're trying to do it on the European, on the highest level in Europe, first of all, together with the approval from EMA. After that, much easier when you have approval from EMA and you have some kind of roadmap, which is a recommendation for the member states. I think these both tools is somehow like a weapon for us to use on the national level for easier acceptance. And also, if we know the numbers that the patient who need to receive this therapy, is how you mentioned, Louise.
One of the senses I'm getting listening to everybody is that while the patient is the end user, and in that regard, the most important customer. On a lot of these issues around value, everybody sounds kind of tangential, not being in some of the key rooms, not being there at some of the key moments. Do you envision a world where that gets better?
Oh, Roger, that's a wishful dream. You must be in.
Wayne, I'm not sure I do. I was actually looking for somebody to give me a more hopeful answer than the one I would have come up with.
You know, one of the great challenges we have in the U.S. in particular is the very fragmented payer system. You know, everybody has their own vote, and there are some broad currents that are kind of led by CMS and so on, but each of the insurance payers has their own decision-making groups, and it's just an endless series of discussions that take place. We've tried to have some impact on that from the Fatty Liver Foundation, but we haven't had the ability to dedicate staff to do nothing but beat up on the system and the payers and try to gain access. I mean, it's a very long-term thing. And I really appreciate GLI investing in that kind of consistent effort. So it really lets us off the hook a little bit so we can focus more on the patients.
I think the other thing is, whilst the patient will take the medication, they are not the market. The market is the payer. It is the physician who's going to do it. They have the money. They are where all healthcare is targeted. Medication may be directed at, or a test or an investigation at who we're going to use it on, but they have never been the market that healthcare or drives in. We always deal with it's a business, whether it's a private insurance payer business, whether it's the NHS. I've heard it described as product. The patient is the product. It is the way it is done. Remember, that is where it's the target. They are not the end payers. And you have to make the end paid like NICE. NICE do it on cost effectivity. It's not necessarily about the patient. It's about the cost effectivity of the medication in the group. So we would love to always see that the patient is the center of that focus, but that is not often the way medicine and health talk. And I think we've seen that in the nomenclature. We've seen that not just in this disease spectrum. And I do think insurance will play a big role. We get incentivization from insurance companies to be healthier and fitter. Now they can use MASLD. They can use weight. They can use all of these things. We have Wegovy or semaglutide. We have tirzepatide. We have resmetirom coming in. We've got more and more medications that make that easier for them to say, you've got to have ticked this box, and this box. And I'm sure this is where Jeff and GLI with their global umbrella can help drive different countries. And I think that's going to be the interesting part of this. But this will come down to an individual position of how he's going to prescribe or she's going to prescribe this medication and what part of that is their income and the way this works out. And I think that may well come into play here more than who's the end user of something we've sold to this particular group. And that happens throughout Europe. It's a very common way of healthcare. It's about the purchaser, not the end user.
It seems to me the payers are kind of the last frontier in caring what the patient thinks. A lot of the pharmas are certainly willing to talk to groups like ours about what we think and so forth. The FDA, some days you think they care about what you think, some days you think they don't. But I would say the payers are the last frontier. We haven't reached out to them in regards to covering medications, but just in terms of having an interest in helping us raise awareness, which would lead to disease prevention, which you would think would be an economic case that the insurers would be interested in, but they don't want to talk to us, has been our experience.
All right. I think how to encapsulate all of that. Wow, you've got smart people on the panel today, Roger. I would say foremost, payers are one of the last sort of places that we're looking at, but we have been banging this drum for quite a long time. I mean, this is the point. The PDUFA on March 14th has been the time, as I said earlier, where we can get the questions answered that we've all been asking. Granted, I don't want to take anything away from resmetirom in terms of its potential for usage with the community and the patients that that it can serve. But there is a second achievement in this approval process, which is now we get to answer some of these questions. How are the payers going to respond to a narrow market segmentation? Is there going to be a rush on the market? Can we get reimbursement for this narrow piece? And then will that set a precedent for how we go forward in other areas? Will it be consistent throughout U.S. systems, not just in terms of CMS, but what's the VA, the Veterans Administration, going to do on top of this as well? There are, to us at GLI, I keep using this phrase, there are very many here and now issues that we can now engage once we get that check mark from the FDA, and we'll start moving towards that. In terms of your question, Roger, originally about kind of the patient engagement, if you will, about patients being kind of tertiary to the case, yeah, absolutely, that's been the case. This is why we push for patient inclusion at every stage, because we have the authority, we have the expertise. We may not be the end client, as you say, Louise, but we are who they work for. We're the client in this. And I think we could go back as far as Larry Kramer, even before, him in AIDS and whatnot, to talk about whether there was a level playing field for patients engaging in these ways. And there's just not. And so this is why patient engagement, why patient advocacy exists. This is why we've got good people around the table here talking about this. And this is why, again, we're cautiously optimistic about an approval for this asset. So we can now start answering some of these questions. And if we get the answers that we want, then we expect to have a wider door open for other assets and other therapies to start coming through. This is not the end result. This is only the opening to the door to the beginning.
Check. Okay, Milan, you had something you wanted to say, then I have a comment I want to make, and then I want to go in a different direction.
Because we mentioned a lot of times the payers and why the payers, how to get the access and everything. What is most important, if you see from other perspective, from the perspective of the payers, what is most important for them? When you mention some kind of access to be eligible on the market and why this group of patients to get this drug. You have different kind of, let's say, perspectives. One of the perspectives is that this, let's say, particular disease, if we get this particular medicine for this disease, what we exactly achieve. That is the analysis which more or less they like to know. And the problem is that if you use this drug, tomorrow you will reduce what? And that what you're going to reduce, how much costs? And you will make this analysis through the cost of this medicament. This is very important, especially in Europe. Every time when we're discussing, we're using, let's say, some comparative method to explain them that if I treat this group of patients, I will, let's say, reduce liver cancer in the next period of, I don't know how much money will cost that. And if you use, 10 million for this, you will reduce costs in the future for this. Sometimes they like this because the payers every time like to have numbers, how much people you will treat, how much will cost all of that for them, how much they need to pay, and how much eventually they will save in the future for the next period if they treat this group of patients. If we say, let's say, this is one of the perspectives which they usually like openly to discuss with the patient advocates in different countries in Europe, why to treat so many patients and what is the reason? If you can change with the lifestyle, what is going to be this reason why you would like to use the particular medicine, what is exactly the benefits and all of these things. And also together with the scientific community, especially with the professionals, we have the numbers, surveillance incidents. All of these things are very helpful. For that, the last our meeting in the parliament, when we discussed about the liver cancer, when we mentioned the risk factors, how much money they will spend if they don't treat hepatitis, if they don't treat MASH, if you don't treat alcohol. On the end of the day, they will spend how many in the transplantation and all of this. You can make a good, let's say, statistic tables with these analytics, and every time to have to be prepared because everything what is on the table, it's not just for better of us like a patients and the patient communities, but in the same for them for the next period. Of course, not in the moment, but this is one of the things which I would like to mention.
And thank you for that. At one point in time, I functioned as a pricing consultant. So I listened to this conversation with real interest on several levels. First of all, pharmaceuticals are unique in that it's really a tripartite market. One person prescribes, one person pays, one person takes. Now, sometimes the person who pays and the person who takes is the same person. Prescriber is never the person who pays, right? But if those three things don't work in unison, then you've got a problem. The easiest way for a drug not to succeed, for example, is for the first several patients who take it to fail to comply with it, because then the doctor will not see success, and then it will tell the doctor the drug doesn't work. And, those decisions get made office by office, really. So all that is a challenge. Now, the best strategy people have come up with over time, going back to what Jeff said, is banning narrow population and taking a price against the narrow population, because you wind up doing two things. Number one is it's now in the payer's interest to enforce the narrow population because they're going to get killed financially if they don't. And it means that the manufacturer has the money to invest in all the education that has to get done. This is not that I'm telling you guys something you don't know. The educational challenges around a disease that 30% of the population has are massive, massive. We're anticipating having primary care prescribed. Primary care don't even know what the disease is for the most part right now. So enough money has to come into the system to educate for this to get off to the right start. And doing that becomes really challenging. And then when you go into other markets, it gets even trickier. So let's shift gears a little bit. I'd like each of you to talk about one program in particular that you're excited about in 2024 that your organization is putting forward. Just pick one.
I'll be happy to start. Our flagship product is what we call the State of MASLD NASH Care in America, which is a survey of patients and their experience before and after that they've been diagnosed. And we've been doing this for a few years now. One of the things that we're excited about, if you will, is that with the nomenclature change, we are interested to see what kind of changes take place over time in the patient community and how that affects the way patients are diagnosed and or the kinds of support that they receive. So this will be a very interesting year for us since the nomenclature is a brand new wrinkle in our field.
It's a great piece of work, and I can't wait to see what you come up with this year. So thank you for that. Tony, go ahead.
Yeah, Roger, an episode or two ago, you and Louise talked about the concept of liver awareness, and that's really the world where we live. So our top goal for this year is to get into schools to talk to children about their liver. And in that regard, we've developed a relationship with a local organization that has an exercise program for children, and they have relationships with 250 schools and community centers. And we are now their nutrition partner. And in 2 weeks, we're having our first visit where Gina and our executive director will be addressing about 160 elementary school children in a local school district. Now, the onus is on us to make it like an entertaining or engaging exercise. So we've arrived. My 10-year-old grandson is going to dress up in our Livy the Liver costume and going to accompany Gina into the school. And she'll be talking about, hopefully in an engaging fashion about the importance of the liver. What about liver disease? What the liver is, what it does, how to keep it healthy. And we're envisioning doing a lot of that this year. And that's our number one initiative.
You guys do such cool stuff. That's great. That's great. Milan, one initiative this year.
This year also we will continue with one of the pilot programs which we started 2023, which was very successful. That was the European liver screen week in front of the European Parliament. We have enormous success, I must be honest, because for the first time we have such a great opportunity to introduce the liver screening to all the MVPs in the European Parliament, and together with the high-level event inside to discuss about all the challenges. This year we particularly like to make a bigger, initiative to make maybe 2 or 3 different mobile units, which we used the last time. We like to do this on the practical way to see the people that sometimes are very easy, some kind of diagnostic tools. You can see just some of your results for your liver, which giving, a perspective that do you have some kind of problem or not. We like to show to the policy decision makers that we need to establish some kind of liver screen programs in Europe, because through the initiatives which is going on the moment in European Cancer Plan was 8 different are established 8 different screening programs. We will push also liver screen initiative together with ESL, with all our partners, and we are also grateful for the support of July because they were part of this initiative. We're trying to show not just with education and high-level meetings, but practically how they can see on the spot what we can do very easy to discover the status of the stiffness C and the cup. And this is also an excellent opportunity for the all national members who will support this year, this initiative, because we like to make this initiative to grow in more countries in Europe.
Fantastic. All three fantastic. Jeff, you have anything you want to add before we go to final question, or Louise, about a program?
Yeah, I'll add one quick thing, and it's the thing I'm most excited about that we've really grown this year at the Global Liver Institute is our Advanced Advocacy Academy, also known as A3, in shorthand. And while this is kind of the heartbeat of what GLI does, and it's our patient engagement and patient training kind of program here within GLI that recruits globally for patients to come to Washington, usually in September. But what I'm most excited about that is that we had such a great response last year to our 80 plus patients and caregivers that showed up for our training and our Heal Day, is that it actually grew roots. And so now this is a year-long program. We have created an ambassador program around it in areas such as clinical research and digital health that are now being patient-led and patient-driven. And we're just super excited about this, that we can support patients in their areas of need, that they can then get education and training on how to do everything from talk to their doctor to be able to tell their story to the officials, to be able to help one another with working their way through different medical portals or clinical trial portals or answering those questions as well. And personally, I've just met some tremendous people that have waged battles that I can't imagine in this area. And so I'm really thankful, and we're looking forward to continuing our program. I presented on clinical trials to a great group last week, and I'm just super excited to keep that going.
Fantastic. Louise, anything you want to comment on?
No, I was just in awe at the 4 topics that were chosen there and the breadth of those. And that's why patients are the best place to be involved in the entire process, at the center, at the core, and it should be all designed around that core as the patient, because they do know best. And if you just listen to those topics for how it affects the patient in the name change, how it's done all sorts of things there, spread out, it's just amazing. And I'm looking forward to seeing those. And I obviously align with looking for liver health and Tony's engagement with children. And there's some interesting things you can do, from wearing boxing gloves to show how difficult it is when you're a liver cell to try and move things. If you put boxing gloves on the kids and get them to lift little things with their hands and things. There's all sorts of exciting things you can do to getting children engaged. So I'm really excited to hear the results of those.
So Louise, you and Gina should write a children's book.
Well, there's a great one here in Australia called Gary the Goanna. The one thing is, everybody keeps writing the liver out of the story. Now, with the approval of resmetirom, we may now have to write back the liver into the story. You go on a diet to change your heart. No, you go on a diet to change your gut and your liver to help your heart. You're on a diabetic diet. No, you're on a diet to change the gut and the liver to change your diabetes. So we need to write liver health back into the story, because it is the biggest player before we get disease. Now, that does not include, obviously, the rare diseases, but by looking at liver health, we will pick up disease. So it is very much what these guys are driving globally and in their regions. And that's what fills me with excitement, is watching what's coming with this lot and the other advocacy organizations around the world.
Excellent. Okay, last question. It's 12 months from today. It's February 13th, 2025. What will tell you whether you've been successful, looking back over the last 12 months, whether you and your organization have personally achieved what you set out to do in a good way? Brave one, go first.
In our situation, because we're dealing, most of what we deal with are people who aren't aware, who don't know anything about liver disease, fatty liver disease. So we'll track the number of people that we reach and, hopefully impart a lesson, to them about liver health and so forth. So it'll kind of be number of people reached will be how we'll judge our performance.
Okay, Wayne.
Principal focus for us this year is to do a better job of engaging our ethnic and underserved communities. We've had a lot of experience, like everybody in this field, with the Caucasian population, that we really want to build our access and our support for the ethnic and underserved communities. So if we can get those numbers to reasonable values in our various programs, I'll be happy.
Okay. Okay, Milan?
If you see previous success, what we've done a little bit, I will say, and how we go out from the frame, 2023, I will mention, and it's coming 2024 with a year of elections with new policy decision makers who's coming on the scene. We will continue the work which we like the new group of politicians who's coming on the scene to understand the needs of the liver groups. This is most important because especially the past 2-3 years, somehow we managed liver disease to put higher on the political agenda in Brussels. And now we like to continue to stay there and to improve our status, of course, and the new establishment which are coming from the beginning to understand the unmet needs of our communities. This is number one, which we will focus. And the second part is the focus is the same time health generally to be on the agenda because we know that after COVID, European Commission changed the pathways and for the first time in the history make such a good, excellent improvement in the health. And our fight is, let's say, to stay the health high on the agenda, and after that, liver disease to get the deserved place among the other diseases. Because we know that in the past was a little bit difficult, even barely to mention was the question about liver disease somehow on the political scene at Bristol. But the last mandate of this parliament and this commission, we are so proud that we have achieved so many things. We are not satisfied. We need to work much more, much stronger, and we need to have much partners and stakeholders like you who will share with us all the moments. This is very important for us, and I hope so that in one of the next meetings I will have the privilege to invite all of you. July has already every year with us, but I hope so all of you to come to visit Brussels and to see all the possibilities what we can do there. It's a pleasure, Roger, that you invite me tonight and have the chance to say a couple of words about our mission and our work and our partnership with all of you.
So I have one Belgian grandparent. Obviously, I'm old, so my grandparents been gone for a long time, but I never pass up an invitation to go to Belgium. So I figured out how to get there, Milan, but thank you very much for that. Jeff, 12 months, how have you gotten this right?
I think I will stay consistent with the theme of today's discussion, Roger, and that's the hope and the optimism that we have an asset approved, have a drug approved, and that we're able to work through the coding questions, through the payer questions, through the reimbursement questions, all these things that have been, knocking at the door for us that we've been talking around for the past however many years, and that this sets the stage then for us as patients to be able to start pushing these conversations in other countries globally. And so we're queued up, not just in Europe, but in Latin America and in Asia on this, that we're already looking 2 and 3 steps down the line on this as well. And then we're also able to keep it at home here in the U.S. and looking at what are the next assets that are in the pipeline that may not deal with the exact same population, but then how can we continue this good momentum of positive results in patient access for that?
Excellent. Louise, you got one?
I was just thinking it's Valentine's Day here, so I am just going to say that I'm going to love watching the liver become the hero for next Valentine's Day, because I think we are going to start to write it back into the story. And if you love your liver, you can love your life. And that's what we're doing. So happy Valentine's Day from Australia. And you guys will join me shortly.
And anyone who knows a good children's book illustrator, please send that information to Louise so she can get the children's Love Your Liver series into the works. Milan says he's got one. Okay, fine. You guys can talk about this later. I'll tell you what I would like to see in a year. I'd like to see alignment enhanced, because first drug approvals are the moments when alignment either gets a lot better or a lot worse. And to me, alignment is payers know what they're paying for, physicians know who they're prescribing to, patients know why they're supposed to take it, and the advocates kind of become really the fulcrum for putting as much energy into getting all those elements right as possible. This is a huge disease. We get one chance to get it right the first time. And they say you never get a second chance to make a first impression. I don't think that's quite right. You can make a second first impression, but it's really painful and expensive. So if the first impression is well aligned, then I think we do great. I want to thank all of you. I think this has been a fantastic conversation. This might be the longest podcast recording we've done, at least in a year and a half. Clock me in right now at about an hour and 22 minutes. It'll probably be about an hour by the time it gets out. Jeff, Wayne, glad to see you back again, and glad to hear that you're doing better. Milan, great having you on. We'll have to do that again. Jeff, Tony, pleasure every time. Louise, are you going to go rowing at 6 a.m. again today?
No, I pulled my back the other day, so I'm giving it a rest.
Take care of you're back, and happy Valentine's Day. And we will be back next week. Just a note to listeners who don't stick around for the business report. Next week, we're recording on Thursday. We'll be posting on Friday. We'll have more about that out in social media. And until then, everybody stay safe, surf on, and we'll see you on podcast. Bye-bye now.
And now for the Season 5, Episode 2, Business Report.
Slava Ukraini, glory to Ukraine, and also Am Yisrael Chai, the people of Israel live. 2 countries, 2 wars, 2 stories, but 1 set of actions from the U.S. Congress. This morning, the U.S. Senate passed the emergency aid bill for Ukraine, Israel, and Taiwan. Now it goes to the House of Representatives, where the Speaker says he will not bring it up for a vote. But let's see. There are ways it might happen anyway. I continue to be inspired by the Ukrainian people and their brave ongoing fight for freedom. I appreciate Europe's continued commitment to support Ukraine and hope the U.S. will sign on again soon. Gaza is more complicated. Hamas must be eliminated. But, or is it and, the slaughter of innocent Palestinians must stop. Every day, it becomes clearer that Israeli leadership is out of sync with the rest of the world on what this war should do. And the world is losing patience. Let's hope the Israelis find a more humane way to conduct their war. If not, all the foreseeable outcomes are horrible. At any rate, here we go. Slava, glory to the heroes of Ukraine, and also Am Yisrael Chai, people of Israel live.
Thanks for welcoming us back so warmly.
Our first week back after a reduced schedule on the month of January off, and we're already in top 250 lists in 6 European or Asian markets. We've got excellent episodes coming up for the next month and a half or 2, so tell your friends and coworkers to check back in with us. They will not be disappointed.
Here's more news on the question of the week.
Question of the week kicks off with next week's nomenclature episode. In simple form, I will pose a question each week after the roundtable discussion, but before the business report. We'll also post videos of the question on LinkedIn, Instagram, TikTok, maybe a few other places. I'll have video out next week describing this in greater detail. If you subscribe or are on our mailing list, you'll get a link to the descriptive video when it comes out. There'll be a lot to ask, so please get your questions ready. We've got a whole year of questions ahead.
Next week is an exciting discussion with leaders of the Nomenclature Initiative.
I'm really excited about next week's episode. Some of the key global leaders of the Nomenclature Initiative will be joining us to discuss the process, what comes next, what they've learned all the way through. Because of the challenges with various people's schedules, we're recording Thursday. Hope to post the episode Friday night in the U.S., conversation Sunday, Monday. You're not going to want to miss this.
This week's Vault comes from a conversation with Jeff McIntyre last May.
Last May, we had a far-reaching conversation with Jeff McIntyre about a whole array of issues, ICER, nomenclature, drug development, what patient advocates are looking for, etc. I've selected this conversation from that set to be part of this week's episode because it aligns with some of the things that we talked about in today's episode itself. Hope you enjoy it. So that's it for this week. I want to thank the team, Louise, Mike, Eric, Steve, and Jorn, who is sick and couldn't be with us today, as we all march ahead into the brave new MASH world of 2024. Next week, as I said, we'll be back with some of the key players in the nomenclature process, and we'll be kicking off the question of the week. So that's a lot to look forward to. Until then, stay safe, surf on, see you on the podcast. Bye-bye now.
Have any questions for the surfers? You can send them to questions@surfingmash.com and we will answer on the podcast or website. Your question might even wind up being the question of the week.